Hi, everyone. Welcome back from the break. You're here today with us at CNA's third Anti-Racism Summit. We started out the morning or the first session with an incredible presentation by Dr. Itoa, and now we're so delighted to introduce you to Sara Fung and Amie Archibald, co-hosts of the hugely successful podcast, The Gritty Nurses, for our very own live podcast session today. Over to you, Sara and Amie.
Hey, folks, we're so excited to be here and to be able to have this conversation with you today.
Yeah, we're going to be talking about something really interesting, something you might not have heard of before. We're going to be talking about performative benevolence, and that is a mouthful. So, I think as we're going through this talk, I want you to think about performative benevolence in terms of actions and words. So, really, if we break it down to really simple terms, performative benevolence is when your words speak louder than your actions. And obviously, what we want are our actions to reflect our words. Go
Yeah,
ahead.
and I would also just to add to that, I think there's a level of altruism, right? So when you're thinking about performative benevolence, you're the whole aspect of it being performative is it's not altruistic, and that's a problem, right? At the end of the day, we want to see sustainable types of changes. And if it's on a performative level, we know that it's not going to benefit what the communities and the various different people that we want to see change from. It's really more self-serving. The one thing that I'm looking for is how to share my slides because I do not see that option here.
So, as Amie's talking, also think throughout this presentation whether your actions are uplifting or harming the group that you're trying to support. So, I think that's also really important. And also asking yourself, is saying the right thing enough if our actions are not aligning with our words? So, Amie and I have been talking for some time about this sort of topic, about anti racism, about allyship. I know that a lot of you folks here today feel very strongly about some of these topics. As we're going through the presentation, we want this to be interactive. We will have a chance for you to put some questions into a program called Mentimeter. We're also going to have some time for Q&A. Amie, I see, has the slides up now, so I'll let her take it from here.
So one of the things that we would like to start off with is a land acknowledgement. And this is actually kind of interesting because we were talking about performative benevolence. So what does it mean to actually have a land acknowledgement at the beginning of, a session in terms of us talking about, recognizing the lands that we live on? Well,
Mhm.
one of the things is to make sure that it's not performative. It needs to also be from the heart. It needs to be something that you're truly interested and passionate about. One of the things that myself and Sara are passionate about are Indigenous rights. And it's not good enough just to say, here's where we're coming from, but it's also just to, be members and wanting to, work in solidarity with communities to fulfill the Truth and Reconciliation Act. So as much as we are coming to you from Hamilton, the city of Hamilton, which is the traditional territories of the Erie, the Huron, the Wendat, and the Haudenosaunee, we also recognize that we have a lot of work to do as individuals, as partakers, as caretakers, to do more work to recognize that, we have work to do in terms of this Truth and Reconciliation Act
Mhm.
and seeing, what we're going to talk about a little bit more in our presentation about, governments and various different folks say, hey, we're going to do this work. We're pledging
Mhm.
to do this.
Mhm. Mhm.
And their words are not backed up by actions.
Right. And we're recognizing that this land acknowledgement is a starting point. There is a lot more we can still do. I encourage you to take it upon yourself to learn more about truth and reconciliation, talk to somebody who has been affected by this, and really just understand the history of the Indigenous peoples and the country that we live in.
And then lastly, to add to our land acknowledgement is also to recognize folks that might have been brought to Canada or known as Canada forcibly through the transatlantic slave trade. So honoring and paying respect to folks from African descent and African heritage, because it's important that we recognize that as well. So we need to talk about the rising levels of hate. We cannot we would be remiss if we don't talk about the fact that we're seeing
Mhm.
this rising level of hate. We're seeing it through social media. We're seeing it through actions that are happening, whether it's, a stroll to the grocery store or just, at work, we're seeing this level of rising hate. We're seeing this emboldened state where people feel that they can say and do things that are racist.
Right. And I think it's really alarming actually to see the rising level of hate both in person, face to face, and online. I think these are two things that are very concerning to us. I have noticed an increase, especially during the pandemic, of people being less accepting of others, for people saying things to people's faces that are absolutely horrible. Like, we need to treat people as people, no matter where you come from. It's okay to have a difference of opinion, but we need to be respectful of each other. And I think just online, these keyboard warriors that we're seeing, it's gotten to epidemic proportions. And on certain platforms, there really are no checks and balances. So we need to talk about that and recognize that levels of hate are occurring in all different groups, right? It's not just one group that's experiencing an increase, it's all different groups.
And even bringing it back to that essence of performative benevolence, when we're seeing this rise of hate, we are expecting, people to act. We're expecting people to say something. And again, at the end of the day, we're going to touch on various different examples that we've seen in terms of performative benevolence. But now it's so crucial for us all to play a role, all for us to have a part in terms of seeing this rising level of hate. And actually, the other piece is recognizing and understanding those dog whistles that we hear, maybe, whether through it's a political conversation or whether it's through just even a general conversation, understanding what those things mean and how we can, for one, truly be on the forefront of making change and actually seeing what allyship looks like. We're not going to get too much into allyship because we know our next amazing speaker coming up was going to talk about it, but we have to be ready to talk about what actions look like and how we can move toward action, because at the end of the day, performative benevolence does hurt people. Mm-hmm. It hurts the various communities that we want to protect. But again, we don't want to get too much into it because we have so much discussion in relation to performative benevolence. So we're going to go to the next slide here.
So we're just going to talk about an increase in rising levels of anti-South Asian hate. And this has really affected a lot of communities. It's been something that really affects a big group of people. And I think that, it's just something that isn't always talked about, but I think it's very important to highlight the fact that all different ethnic groups are facing increasing levels of hate. So whether it be verbal or physical or both, this is something that is really concerning and needs to be called out. If you go to the next slide, there are some really sort of painful quotes out there. There are individuals who have been targeted. There was a quote right there that actually talks about a woman who had her phone slapped out of her hand multiple times by a perpetrator and nothing was done. There have been people that have been called racial slurs, that have been told to go back to their home countries, that they smell. And again, I think we need to talk about how to not be a bystander in these types of situations, because I can't imagine that nobody witnessed this, right? I think that in every case, there is someone that could be doing something. Maybe there's a level of fear that you don't want to be the next victim, but there's certainly something that we all could be doing.
Absolutely. This is a big one. And I think most people can recognize the picture that is up on the screen and recognize and understand the story and the narrative behind the murder of George Floyd. And I think one of the things that we saw was many organizations came out, and specifically even healthcare organizations came out and said, we're going to take a bold stance against racism. We're not going to let this happen. We're going to take action and we're going to see things different. Well, here are some of the signs associated with that performative benevolence. There's that public display. So you might see people putting those, I think there was a period of time where people were putting blackout pictures on their social media. Mm-hmm. Great initiative, but it didn't actually bring fruition. And again, it didn't actually bring change. I mean, changing your picture mm-hmm. to a black logo it's a nicety, but it doesn't actually move the needle. Again, mm-hmm. that would be what would be considered performative. Also, sometimes we see, unfortunately, those instances of self-promotion. I think Sarah and I would call these grifters, mm-hmm. Where they see a topic that's important. So whether it's social justice, whether it's racial inequality or health equity, that they see these items and they jump on them to capitalize from them. Capitalism is such an evil thing. But unfortunately, we see people that take these opportunities where there are horrible instances that happen, and people use, fake altruism, performative benevolence to self promote.
Mm-hmm.
And again, the intent behind these actions are often more to enhance their own reputation as opposed to, making change. So it's again looking at gaining social approval or trying to be a part of a positive change, but not actually feeling that, or having no idea or no feeling that you're going to do any work in relation to it. And again, there's that lack of sincerity. While the actions themselves may be apparently benevolent, they lack genuine compassion and empathy for the cause of the people that need to be helped. So again, in instances related to George Floyd, Breonna Taylor, Aubrey, all of these different folks. And there are even more recent names. I saw one just recently on Instagram of an individual who called the police asking for support and had someone breaking in and was murdered by the police. All of these instances. But when we start seeing these performative types of actions where, it's not centering the communities, it's not centering the voices of the people who are affected, and that someone is, making gain from this,
Mm-hmm.
or sell, or, they're now selling something in relation to that, that's problematic. And again, that is a clear example of performative benevolence. And
Mm-hmm.
we're calling out all those healthcare organizations that said they're
Mm-hmm.
going to do something and have not.
Right. And I think you need to go with your intuition and your gut. And if something feels icky to you, if it doesn't make you feel good, there's something that's performative about it, right? I think that this happens all the time in the form of microaggressions. We're going to be talking about both, but I think that you know best what feels good and what is actually going to move the needle in the right direction.
Yeah, and just the other piece is it's really important to really just be able to distinguish between acts of kindness of people being genuine and being genuinely wanting to help versus that performative benevolence. So, while they may say that they're helping others, it's really the motivations what we need to be kind of looking at. So like what is motivating this person to act? Is it out of selflessness? Is it in solidarity with communities? Or are they acting on behalf of communities? Are they speaking for communities? Those kind of things are triggers to say, hey, something here does not seem right. And those are things that we should recognize in terms of seeing performative benevolence. Here's another example that I'd like to show. So we just talked about land acknowledgements, the Truth and Reconciliation Act, and the fact that, we have to be able to move the needle and have these conversations. And this strikes me as one of the most biggest and boldest forms of performative benevolence yet, really. The fact that, we say that we're committed as Canadians to truth and reconciliation, but on the other hand, juxtaposed, we're saying that Indigenous people do not have a right to clean water. Like it just
Mm-hmm.
flies in the face of everything that people are trying to say. Again, showing that, we're saying the right things, but not necessarily doing the right things.
And I think there's something called normalizing the abnormal. So people have been talking about lack of access to clean water for decades. And I feel like at some point, people, news outlets just stop covering it. And we really need to bring this to the forefront. We live in a first world country, or we say we do, but yet why is it that people don't have access to first world things that are necessary for their health? And that's just one example.
Again, we need to make sure that we're looking at why why we decide to do things, why we decide to help, why do we decide to be a part of movements. And at the end of the day, the emphasis should be on the other. It's not on yourself. It's not about self promotion. It's also about follow through. So if you're saying that you're going to help and you're going to support, what are those actions? What are those things? What are those keynotes and those takeaways that you're going to do to actually show that you're working in solidarity with these communities? Again, seeing that follow through, seeing that you're prioritizing the actual impact of the work versus yourself, those are ways to get away from performative benevolence. And then if you see it on the opposite side where, at the end of the day they're promoting themselves, or they're
Mm-hmm.
promoting, oh, look at how well we've done, look at our DEI stats, but nothing has changed because the employer satisfaction rate is less than 30%, we could probably put the nail on the head to say it's performative.
Mm-hmm. So we
Oh,
wanted to actually show a video. And before we show it, I just want to put out a trigger warning because it is very raw. It's very real. It's something that happened recently. And we understand that this can be troubling for some people to watch today. So if you feel that you are going to be affected to this or affected by this, please know that you can step away for a second. You can get some air. You can reach out to someone if you want to talk about this a little bit more after our session.
yeah, and again, we always want to come and make sure that we're coming from a trauma infused and a trauma informed lens. Again, we are talking about racism. We are talking about racism that happens within our various different cultures and ethnicity, and this video does depict that. In relation to again, this video, I think we're seeing, like we touched on the beginning, that level of rising hate.
Mm-hmm.
And again, we'd be remiss if we didn't touch on, the thing that probably everybody's talking about, which was the recent November 5th elections, and talking about, the fear that we're having. And one of the things I want to say to folks that are listening out there, particularly racialized folks, is the fact that, I strongly believe that we still have such an integral role to play. And although that things are changing, the temperament and the climate is at this bubbling level, which we haven't seen in years. We're seeing, various different cabinet picks. We're concerned about some of the rhetoric that we're hearing and seeing, and particularly in this video that will show some of the things that we've been seeing and how challenging it is. I want people out there to truly feel that there is something that we can do. We can be a part of change, and not to feel really down. Because I'll be honest, I felt down. I remember being very hopeful to seeing change, but being also a realist and saying that, I've seen evidence that, after election cycles, particularly when there are large challenges like COVID-19, that for whatever reason, the political climate tends to choose the opposite of whoever was in power at the time. And again, people are scratching their heads, but I think we have a moment here to do something radically different. And again, this is my call is coming from inside the house. So the racialized people are feeling it, but it's a call to ask other people to also stand in solidarity with us. I'm going to check the video.
Yeah. Yeah. And I think that, as we watch this video, think about how did this person feel so emboldened to do what they did? I think that's a real question here. And think about what you would do if you were the person at the other end of this racial attack. What would you do if you were someone who was in the crowd observing this? What would you do if you were the person filming this? Like, I think there's a lot of questions to be asked here, but at the end of the day, it is a very difficult situation. I don't know if there's a right answer. Just it's really shocking that in this day and age in 2024, after all the work that's been done, we're still here. And I don't want this talk to take on a huge negative tone, because we are going to talk about tangible things that you can do about it. That's who we are as greeting nurses. We always have takeaways, but just know that it is a difficult time for a lot of racialized folks, and there are great things that are being done, lots of initiatives, but we're still here in this day and age.
Amie, sorry to interrupt. There was just a bit of a disconnect. We would need actually the link to be able to play, because we can't play it off of the PowerPoint the way Zoom set it up.
Okay. You know what? I'm going to try to press play and see what happens. Maybe the sound does work, but I think people might be able to get the
I think you
context
can actually get
anyways.
the context without the sound. So why don't we try that?
Okay. Let's see here. Can you hear it?
You can turn it up a bit more. It was louder.
You can't actually hear what he's saying. It's more like what he's doing.
Listen, in a way, this is a who is this video, and yes, I'd like to know who this scumbag is, but that's just a small part of it. This is just tip of the iceberg. This is part of something much bigger and much more nefarious. For example, if you haven't seen, officials condemn racist text messages sent to Black residents in several states. Thousands of Black men, women, and children received racist texts the morning after the election. I myself had at least 10 people reach out to me who had gotten texts or who knew someone who had gotten these texts. texts saying, hey, you've been selected to pick cotton at the nearest plantation. And even more posts on social media of other people who would experience and receive these texts. Some of them even personalized. Some of them even listing the person's name. This is not like a one-off. This was a coordinated effort. This was a group that planned this and had that plan in place and executed it after the election. They felt emboldened to do this. Just like that guy felt emboldened to get in that woman's face. And I'll give you one more. There was someone I know in a group that I'm a part of that posted they went into a big box home improvement store. The morning after the election, they saw a young black woman behind the counter crying, went over to make sure that she was okay. And she told them when the store opened that morning, one of the first customers through the door saw her, it was a white man, smiled, started walking toward her. She stepped up to see what she could do to help him. And the first words out of his mouth were, Trump won. Are you ready to going back to knowing your place as a black woman? He woke up, rolled out of bed, got dressed, put on shoes and socks, and went out into the world, eager to find a black woman he could say that to. Listen, I've said before, and I mean it, I'd love to never ever again have to go, who is this? I'd rather that people just stop behaving in a way that makes that necessary. But let me make this clear. I think in the wake of this election, for some reason, the people who love Donald Trump are even angrier since he won. And a bunch of them feel emboldened, feel like now I'm free to do and say what I really feel and think inside. Go ahead. Let his win give you the confidence to write those checks, because I will fucking cash them. I will make video after video. I will expose you. And Donald Trump will not be there to save you. He'll not be there to save you from losing your job or having people in your life cut you off because of your hateful behavior. If you commit crimes, if you make people feel afraid and small because the guy you like won, that door's going to swing back the other way and it's going to catch you in the ass.
So, Sarah, how did that make you feel?
That was painful. That was really painful on a lot of different levels to watch. The first time I saw that, actually, I thought the woman in that video showed so much restraint for someone who is literally up in her face, saying those hateful things to her. And I can't even imagine how traumatizing that would have been for her. And also the other people in the crowd. We don't know who was in the crowd, but that could have been very triggering. I'm also shocked at this day and age that people would take the time to send those hateful texts that we saw there. And, I don't think we can't explain this away anymore by ignorance. This is not ignorance. This was intentional. Someone took the time to think of these hateful ideas and act upon them. And this is where we're at right now.
Yeah, so again, I was the one who sent that to you, Sarah. And again, like we said, it was triggering. It was triggering for me. It was triggering for me as a racialized and as a Black woman, seeing that, because again, I face hate. And I'm sure you faced hate too. And it's that fear, right? It's that fear that we shouldn't have to have. And I don't know if, I know a lot of racialized people can understand this, and folks that are immigrants can understand this, that, at the end of the day, all we want to do is live our lives. We want to go grocery shopping. We want to do all the same things that everybody else wants to, but having to worry and think about how someone might respond to you based on solely on the color of your skin, or the way that you look on the outside is horrifying. And I feel, again, this is where we need to talk about how performative benevolence can be harmful. So in that example, I would actually call Tizzy. So that he's a social media influencer. His name is Tizzy, and his whole shtick really is calling out bad actors, and that's doing something. It's huge, because he's pulling on community to actually say, who are these individuals? We need to stop it in the instance. Because I think the other thing that we saw there too was the bystander effect. And that is another harmful and most painful thing in relation to, performative benevolence. When you see that something's performative, when you see that the actions set aside are not true or not real, how does that make the other person feel, and how does it affect them? It causes a lack of trust in these systems and these structures. It causes to feel fearful and to not believe that we'll get the support that we need at the end of the day. And particularly in healthcare, think about how that is. Think about how it affects someone who feels that, these institutions have said they're going to do all these things. And then at the end of the day, to feel that, they have not put their money where their mouth is. They have no interest. It's more just, we've checked the box to say we're going to do the right thing, but not doing the right thing. So it creates a sense of anxiety, of mistrust, and then it also creates trauma. Again, we talk about having and seeing care from a trauma-informed lens. How much trauma does this create when people are not being realistic? People are not being altruistic. People are not being genuine. I think all of these feelings are valid for folks that are racialized to feel. But again, it causes harm because then we see people not wanting to seek out care, not wanting to trust the system or these structures. And we know that, these systems and structures are built inherently through a racist lens. So again, there's a lot of work that we need to do in terms of generating trust and seeing that there is harm in performative benevolence.
Right. And I think all the nurses here listening today, I think that we have this tendency, or in the past, I've noticed that we tend to label patients as non-compliant, right? That is a term that we use, but when you see something like this, there's a lot of history behind that, right? So why do people not seek care out? Why were there groups that were hesitant to get vaccinated? Why are some people just non-compliant, quote unquote? I think there's a lot more to unpack here. And sometimes we just need to give people time. We need to give them understanding. We need to give them that grace to, work through their trauma. And unfortunately in healthcare, it's just not built for that. But whatever way we can give people more understanding, more time, we should really be doing that for these folks.
Yeah, and making people do stuff, like making people act. At the end of the day, if you're going to say that we're creating a health equitable system or we're creating anti-racism structures, you can't just say it. You have to do it. You have to show it. And you have to work with these communities. Like, again, if this is an initiative that an organization wants to take and spearhead, it's not them who should be spearheading it. They should be actually consulting communities to say, how can we best make a move on this? How can we best make a mark on this? Because at the end of the day, it's about how they're feeling. Because a lot of people, if you haven't experienced racism, you might not understand what it is that we might be feeling or how we might go about it. So it has to be done, like I said, in solidarity with communities and not for communities. So,
sorry, go ahead. No, I was going to say it sounds so simple, right? But sometimes if you are not from that marginalized group, all you need to do is ask them, what do they need? What do they want? Rather than assuming and potentially causing harm. If you're not completely comfortable with what is happening, just ask them. Yeah. Give them a seat at the table, and even better, give them a voice once they have a seat at the table. That's all we want.
Right. And I think this is where, again, at the end of the day, recognizing that although we gave, examples that happened in the States, this is happening in real time here too. So as you can see, just actually a couple of weeks ago, maybe 2 weeks ago, this picture you see, this was happening probably 20 minutes from our home. Where there was a mass protest. Again, this was right after the election of folks here in Hamilton, Ontario, protesting and putting a sign up of mass deportation. Again, where were the allies? Where was the solidarity? We talk about that, we're not performative, or we talk about that we want an anti-racist society, and we want to do things different. But where was the support? Social media, texting and tweeting and all that stuff, that's great. But we needed to see a stand of solidarity, which I did see through like the Hamilton Anti-Racism Center, the Hamilton Legal Aid Center, and they did have a march. And these are the things that we can do to actually show support, not just saying, we didn't like it and, put a tweet about it,
Mm-hmm. So I think here we just want to talk about, the actual physical effects of racism, right? So it's not just physical, it's mental too. So when we talk about this, it's not just some vague concept that doesn't affect people's health or that we're complaining, right, for the sake of complaining. There are actual tangible health effects to racism. And Amie, I'd love if you could share some of them with everyone.
Absolutely. So I was able to pull this from Medical News Today in terms of a visual of, what are some of the harms that we do see? And again, just linking it back to that performative benevolence, saying that, you're being altruistic, but, you're maybe underlyingly there's a huge disconnect between what you say, what you say versus your actions. But like we said, there are true effects. So there's issues related to having poorer sleep. We've seen increased cardiovascular diseases, particularly in racialized communities, or having a higher BMI and or obesity. We see differences in relation to inflammation or psychiatric disorders, particularly in racialized communities, or I could say even particularly in my community. Black communities we're a diaspora, we are not a monolith, but I do see, for particularly my family, my heritage is Caribbean, where we're talking about openly about mental health was stigmatized. And again, now if you were adding stigma to top of the fact of your actions are not benevolent, they're performative, it is most likely that people are less likely to seek care. Again, we see those correlations in relation to coronary heart disease, as well as stress hormone really increases, as well as high blood pressure. And the other piece here in Canada is we don't do a very good job of measuring health equity and health outcomes. So we have lots of data from like the UK, the US, and various different places, but Canada, we need to step up.
I
Like,
know.
we
Yeah.
know that there are issues, and we have lots of work to do to make sure that if we are measuring, we are making sure that we are going to change some of these outcomes that we see in racialized groups, and particularly folks that come here as if immigrants and refugees, their healthcare outcomes are poorer as well.
I think it's something that can be really easily fixed, right? Because in healthcare, how many times do we screen our patients? How many forms do we fill out? This one question could easily be added to a form. What is your ethnicity? What is your race? Just add it to the box. And in healthcare, we love data. So why not just add this to the list?
Yeah, I mean, there is much more work that goes into doing this, because again, from a standpoint of when I was doing some work in health equity, that there's so many conversations that need to be had. Again, that whole idea of trauma and mistrust. So again, that work has to happen at the ground to make sure that people are willing and ready to do this work, and make sure that they are a part of it, that the data belongs to the communities and not to the healthcare providers. But again, let's say, why are we having this conversation now? Why do you think?
I think that this is a really important time, right? Like we talked about certain political events happening. We're coming off of COVID. It's really difficult in healthcare right now. I think there's also this issue where, how do I put it? I think people are just emboldened to be more rude, right? So I think that not just in healthcare, but even in retail, there's this sense that you can just say and treat people like crap and nothing's going to happen. So I think it's really important to talk about it and talk about the harms of, you know, words and no action. I think it's very it just breaks down a lot of trust with someone when we see someone in power, when we see a celebrity even that says that they support this and that, and then they don't act on it. Or for example, February is Black History Month. Do we only talk about Black history during Black History Month, or do we talk about it year round? Is it something we work on? I think that's really important to identify and call out.
Yeah, I think it's important to have this conversation now, because there is no better time than now. That's my kind of standard in terms of when we want to see change. What is the reason to wait? There usually is no reason to wait. The best time to have these conversations are now. And I think that with the political climate as it is, not just in the States but here in Canada, as well as some of the things that we're seeing, why not have the conversation? We need to have the conversation. And although it may be difficult, or it might be, and I want to change people's ideas on the whole aspect of a difficult conversation. I think if it's difficult, we probably need to analyze that, and kind of ask ourselves questions like, why is it difficult? Again, that these conversations need to be had, because at the end of the day, there's a person at the end of that conversation. There is a family, there's a community, there's a whole society behind some of these actions. And again, at the end of the day, we are talking about racism is a social determinant of health. We discussed the various different factors and how it can affect individuals, and there is no better time than to have a conversation now. So what's our role? Who are we accountable to?
I think that that's a really great question. I think it depends on a lot of different factors, but at the end of the day, we are accountable to, as nurses, we are accountable to the public, right? We're accountable to the organizations we work for. We're accountable to our regulating college. We're accountable to the communities that we come from. So I think there's a lot of accountability here. And at the end of the day, with these bad actors we're talking about, not only do we need to call them out in the moment, we need to hold them accountable for their actions.
Yeah, and we need, like you said, we need to hold all bad accounters, just like Tizzy Ent is doing, just as like, just as like we do. Again, we recognize and understand that it's not easy. Advocacy starts in various different levels, different stages, but everybody has a role they can play. So one of the things I say is, maybe you need to start small. The power of a small is actually hugely important. Mm-hmm. One of the things that a parable or a saying that I had that I was taught from my Caribbean heritage was it's called one cocoa fills the basket. So it's like, taking each small steps, eventually you'll get to your goal. And I think, like I said, I say this all the time when we're having talks. Advocacy is like, different flavors of ice cream. For some people, they might be a little bit more vanilla. I'm a little bit more rocky road. I like taking a path less traveled in terms of how my advocacy look. But everybody has a journey and should be on that journey to really decolonizing, to call out performative benevolence, and really to ask, you said this, how are you going to make change, and find out what that answer might look like and how that looks.
Right. And you don't have to fit a certain mold to be an advocate, right? You don't have to look a certain way. You don't have to talk a certain way. Anybody can be an advocate. We as nurses learn to advocate for our patients, right? So we already have the skills that it takes to advocate. Now, how do you advocate for yourself, for your profession, for healthcare as a whole? It's all the same skills that you already have. And I always think of advocacy is, it gets better with practice. It gets easier with practice. And just going back to these difficult conversations, I would also say they're important conversations. So we don't have to think of it in a negative way. These are just conversations that are really important and need to be had.
Yeah. So again, at the end of the day, one of the things I also want to say is rest is important too, right? So as much as we're advocating, particularly for racialized folks, we need to take rest. We need to make sure that we're protecting our own mental health, particularly when we're seeing all these instances happening, and recognizing how difficult it is to be an advocate and say, hey, I'm standing up for what's right, but also some of these things are really painful. To acknowledge that they are painful, to acknowledge that I can say that I've been there too, to sometimes step away. That doesn't make your advocacy any less. So at the end of the day, make sure that you take care of yourself, and that, it's okay to take pauses in advocacy, to come back to it and do something differently. But my call to action is, if you're not racialized, how do you support folks who are? How do you support and show up, not by putting, a black little square on your social media, or wearing a bracelet, or doing these things that actually don't change the face of what's happening? How do you become a doer rather than just a sayer? And I think that's probably the most important part. Again, my call to action is always to make sure that you're standing with and doing something as well at the end of the day.
Right. And I think about, how do you amplify the voices of those who've been marginalized? So rather than using our struggles to build your platform and profit off of it, give that voice back to the people that need it the most, the people that have suffered. I think that's the best way to do it. Think about businesses in your community that are minority owned, that are Black owned, that are Asian owned, that are Indigenous owned. That's how you can support them, is by, supporting the people that are doing the work. And again, asking what do they need and what do they want, and not assuming.
Yeah. Shared power is a powerful thing, or handing over power. And sometimes that's difficult. Sometimes, it's difficult to let go of a situation in which you feel that you're in control of it, to say, maybe they don't know better, but of course we do. At the end of the day, that's very nihilistic thinking. And sharing power is powerful. And again, it empowers people, and empowers others to be able to do something, to be a part of that change. And I think at the end of the day, we need to hear those different perspectives. We need to have diversity of thought, diversity of voice, seeing various different people in different levels of power, because it's important. And at the end of the day, making sure it's not performative. So again, it's not just we've checked a box, we've added this individual to the table, but now that they're actually given power and resources to make change, whether that's financially, whether that's through being on a board, various different ways to do that. But again, at the end of the day, it's always being a part of the solution and working in solidarity with, and calling out the bad actors when that action is fake. Yeah. But again, a podcast episode is not a podcast episode without us asking our listeners for input. So yeah, we had a really great discussion. Of course, challenging again when we are talking about the ugly head of racism, but we want to hear your perspective. So I've pulled up the Menti. I've probably given us enough time to get to it. So I'm going to shift over. Again, Menti is anonymous, so you feel free to enter your things in anonymously. And if you do want to speak, what I will do is I will monitor, I guess, the hands going up, and maybe if you feel okay, we could have some people actually engage in conversation with us, because that is definitely what we would like as well. So let me shift my screen. So hopefully you've all been able to get some Menti, and let's have a conversation about racism and performative benevolence.
Yeah, and I would just ask the CNA if you do want to monitor the chat and maybe read out some questions to us. That would be really helpful as Amie is pulling up the Menti. And again, this is meant to be building on our strengths from each other. So please feel free to put in whatever you feel comfortable. If you want to take some time and reflect on your own, I would encourage that as well.
So as you can see, answers are coming up in real time. In terms of that first video that we watched, because I remember when I first saw it, I was cheesed. I was so mad. And again, like I know you mentioned, Sara, about the reserve that Black women had to show, and it's like, why do we have to be like, why
right.
Like, why does it have to be like that, where it's like, okay, of course I'm not saying that she should be violent, but the fact that a strength of hers had to be the fact that she held back, that nobody there, I think one person's kind of stepped in, but then backed away, but nobody came to her aid. No one came to her support.
Right. And I kind of wonder, if the roles had been reversed, would that still be the case? I'm just going to put this out there. It's very hard to watch. I will say I've only watched it twice because I wanted to make sure it was going to be meaningful for this conversation, for this presentation today. I see a lot of words coming through. So the biggest word is angry. That's how I felt.
Frustrated, sad,
disgusted, disappointed.
But I see some other stuff too, right? As much as we see the, scared, anxious, frustrated, we have to call those things out. Disheartened, discouraged. I see empowered. Although it's small, it's there. I see motivated. I think that's powerful too, because at the end of the day, when we see these things, we need to be motivated to do something. The bystander effect is probably one of the most painful effects that we don't talk even nearly enough about in relation to racism and anti-racism work, where this is happening in real time to someone and people are watching and they do nothing.
Right.
It is
right.
So traumatizing.
I will have to say though, in the past, I was really hesitant to speak up, and I would feel frozen in the moment, and then I would feel angry at myself as, why didn't I speak up? Why didn't I say anything? So now I take that and I tell myself I need to say something now, because I know I want to, and I'll be angry at myself if I don't. So, everyone's experience is different, but just know that it is something you can work on. It's not a label that you can give yourself that, oh, I can't speak up. You can absolutely change your behavior. You can improve. It is something that gets easier with time.
Yeah. And how powerful would it have been if that individual that kind of did step in for a second just stepped in and hugged her? Because sometimes maybe it's not even the words, maybe it's just an action, or standing beside her, putting your hand on her shoulder, or I mean, whatever might have worked well in that period of time. But again, anything is better than nothing. So we agree with all of these different responses, and thank you so much for overwhelmingly sharing with us how that made you feel. Is there anybody that would like to maybe say something? I think I'm really bad with the time. Let's see.
We still have 15
we've
minutes.
Got time. Okay.
Yeah.
Does anybody want to say how that made them feel before we move on to the next question? And it's okay if you don't. We can maybe take one or two responses of how that made you feel. I see some hands raised, but I can't. Can people unmute themselves? I'm not even too sure.
Amie, so it's Val again.
Okay.
Just because of the volume of people, we don't have that feature turned on.
No worries.
Yeah.
We will move on.
We'll move on. Yes.
We'll move on.
Yeah, thank you for all of you responding. That was a great response rate. I'm really, really thankful for that.
All right.
So the next question is, can you think of some organizations that have demonstrated allyship? So take a minute and think about this. And if you don't remember the name, just put in whatever you remember, because I think that's important.
Yeah, and you don't even have to name the organization. You can just say like, yes, you have, and here's an example. We're going to read some of the various different responses coming in, which are great. I love when the responses come in. First, so we have 6 responses, 7. Okay, I'm going to just start reading some.
Okay.
You read one and I'll read one.
So we have community health centers. Okay. We've got the CNA, so that's good. Yep, CNA definitely, by putting this on and having some great speakers come out and facilitating some great conversations. I couldn't be more grateful for today, and I think that we need more of these summits for sure.
The very first response that I saw was no, and that's awful. That's painful, right? If anybody, if and I think that speaks, because I feel that that's not just one person who feels that way. I'm sure there's many other folks that are just like, I don't see these very clear cut examples of it, of allyship, and to recognize that the fact that there's work that should be done. Again, what we would love to see is everyone to say yes, but again, no is also a real answer as well. So we do see the CRC, yes, the CNA, CCO in Canada project, clinics within larger organizations,
Indigenous community groups coming together for the Black community. Amazing.
Yep, I see Credit Valley Hospital. I see again none. Some places of faith, moms at work, Indigenous community groups coming together for Black communities.
We see the CASN a couple times. That's amazing.
I see someone says my city. What city? Tell me.
Yeah. We see BCC, so BC Nurses Union. That's amazing.
Yep.
Ontario Nurses Association. On Canada Project.
Again, yes, passive, yes, but passive attempts. Surge, I've heard a lot from Surge as well. Prairie Harm Reduction, Public Libraries, Ben and Jerry's. Yeah, I did see their campaign. It's pretty dope. Anti-Black racism, social determinants of health in the Peel region. So lots of great examples that have come through. I do see a comment here that I want to recognize people feeling fear of reprisal if they do. Healthcare Excellence Canada, Canadians for Justice and Peace in the Middle East.
We have the CFNU, that's the Canadian Federation for Nurses Unions.
So, this is great. I'm glad that we're seeing these answers come in, and that people are recognizing that there are organizations that have demonstrated allyship. So again, there's allyship and then there's action. So we didn't include this in. So now the other question, and this is just for off the top of your head, is although these organizations have demonstrated allyship, would you say that they've also demonstrated action within their allyship? So I'll leave that for you to think about. But thank you so much. We've got 93 responses and counting. And of course, CNA, we will share all of these results with you. So let's move to the next. Oh, let me just get some of these. So harm reduction orgs, Yukon nurses. I see organizations, people on the allyship journey. More answers coming in. So thank you so much. But we're going to move on to be mindful of time. Let's go to the next one.
Okay. All right. Now, so this is a bit more of a tricky question. So first part, are we moving forwards or backwards? Just take a second to think about that. What's your first instinct? The second part is, are we moving towards a society that is more willing to combat racism or more willing to stand back due to fear?
All right, we're going to let the answers come in before we start saying. So we're already seeing backwards.
I'm seeing a lot of backwards. I feel we are moving backwards worldwide. We got one forward. Okay. 3 steps forward, 2 steps back.
Yeah, that one I definitely rings true to me as well, because I do feel that there are people and there are organizations and there are movements that are really trying to be progressive, really trying to talk about, diversity, equity, inclusion, and anti-racism. But again, there's that pulling back, for particularly in the US, where they were cutting DEI jobs, where they're talking about this idea of woke and woke ideology, which was a word that's really been bastardized, because again, the whole idea behind what it was to be woke was essentially to be progressive, to understand different perspectives, and to be and really woke, being aware of what your political standings are and what are the social injustices. That's what it actually meant, and it's been flipped on its head to become this very negative, highly politicized word. But again, lots of backwards.
Oh, but we got one comment. I am hopeful. I am as well. That's really promising.
And seeing that political actions seem to be moving backwards, with an actual political context going backwards. So again, I would say this echoes how we feel as racialized women, and that's concerning. It's very concerning to feel that at the end of the day, a lot of us are feeling that we're not progressing in relation to racism, and that there has been a shift to this more backward momentum, and that is troublesome. I think this speaks volumes, where myself and other folks are here saying that unfortunately we're not moving in the right direction.
Stagnant. Only the loudest voices are heard. Yep.
Some people say both. With a felon sitting in the White House, we're going backwards. Forwards, more willing to stand. Forwards, more willing to stand back because of fear of doing the wrong thing. Baby steps forward. At bringing awareness, not yet a movement backwards. Hard to assess because the loudest voices skew the scorecard. That is true. And again, I do want to touch on this, particularly, for example, even thinking about some of the Canadian movements that we've seen, where particularly on social media, some of those loudest voices, not necessarily the most relevant voices or most progressive voices, tend to be some of the voices that we hear. And I could say that that could go for positive and negative forms of talking as well. And I think that sometimes, when we are hearing these various different voices, whether it's a voice that you agree with or a voice that you disagree with, I think what we need to do in terms of this feeling like we're going backward is we really need to have conversations. And sometimes it might be having conversations with people who might have a differing opinion than you. And I'm not saying, and here's my gritty nurse talk, I'm not saying, and I would never do this, I wouldn't sit and probably have a conversation with a neo-Nazi, because fundamentally I just don't agree with that positionality. But I think it's okay to have conversations with people who might have a different political position, and find out what that might be, and find out, at the end of the day, we should be bringing people together, bringing community together. You can't have a difference of opinion, but we should still be able to talk.
Right, exactly. Like, I think about when you have a patient, let's say, that you don't agree with their views on a certain thing, they're still your patient regardless. And I think we need to find ways to have respectful conversations with people that we don't necessarily agree with things on. And it doesn't have to be black or white, like, oh, you said this, therefore we can't talk. But I think it's a skill that you need to develop, right? To be able to understand the other person, and vice versa, for them to understand where you're coming from and why you feel a certain way. That's something we really need to get back to.
Yeah, I see standing still. I see, I think the more people feel comfortable vocalizing their racist thoughts, the more energy and momentum the movement against racism will become. But certainly it will get worse, backwards, plus, stagnant, agreeing with few steps forward and back. I see both anti-EDI op as in a paper today. I mean, I would love for someone to share that with us at some point in time as well. But again, I think we're all having the sense where there's an urgency to having these conversations, where there's an urgency where we must be compelled to do something. And again, it's not just us feeling it, we're seeing it coming through in your answers as well. I'm trying to make sure that I'm not missing any twofold backwards, harder to step forward.
I think a lot of folks are feeling both ways, right? So in some ways we are moving forward, and in other ways moving back. So it's hard to give a one answer.
Yeah.
And I get that.
And I think it'll be really great for the CNA to aggregate this data and really come out and see what are some of the main reasons people feel that we're going back forward, or we're stagnant, or how we might be moving forward in terms of this conversation. Again, I would say this in itself is a call to action. If we feel that in relation to racism as a society as a whole that we're moving backward, there's a lot of work that we need to do.
And just the number of you that have attended today and chosen to participate, that shows that you want to make a difference and you feel strongly about this. And we do as well.
Yeah. So we're going to quickly move to the next question. We have 5 minutes left. Oh, there we go. So, call to action. What could your role look like? Again, everybody has a role to play. And I think this is where, again, I'm calling on folks that maybe not racialized to say, like, how can you be a part of the solution? Because again, it's important that everybody is a part of the solution. And what might that look like? So I know in the next segment, you're going to have Ovi come and talk to you about allyship and what that looks like. But how might you be able to be a part of this movement? How might we not go backwards? How might we progress and move forward? How might we call out performative benevolence?
I love this. So first we've got stay visible and speak up. Absolutely. Not being silent, speak truth, lead where you stand.
Become an active listener. That's so important. Mm-hmm. Sometimes we do so much talking and we don't take that minute to pause and just listen.
Right. What these I know we're talking a lot today, but we do normally listen a lot too.
We listen and then we get to talk.
Yeah.
Stand up and stand with, find your voice, authentic engagement, taking action, yes. Using your privilege. Yeah. Yep. Sarah and I touched on that. And in terms, that's that aspect of power sharing against, these various different structures. I think that's super important as well. Speaking up, call it out when you see it, be supportive of a person experiencing discrimination.
I will stop being a bystander.
Oh my gosh, I hit my microphone because that is so important.
I just want to read the whole thing. I will stop being a bystander as a white settler woman. I will ask uncomfortable questions of my workplaces to call out performative benevolence. That is amazing.
Yeah, absolutely. Be persistent, tenacious as an ally, speaking up. Although I'm not an expert in anything, sit and listen, because sometimes listening is so powerful as well. So thank you for that. Always listen, learn, not always raising awareness, but calling out negative behaviors, being a part of the solution, and education, advocating, critical self-reflection. Like that is looking, like taking a mirror to oneself is sometimes the hardest thing to do, but it's so important that we do that as well. What parents discuss at home about their races make a difference in how their children will be.
Absolutely. Starts at a young age.
Being more engaging. Don't ever call yourself an ally. Seek to be called an ally. That's a point.
That's
true. A PowerPoint right there. Yep. Donate to progressive organizations. That is doing work. Speak up, participate in conversations, speaking up on social media. Yes and no, only because I think you need to find your group, find a place where it's safe, because
find your tribe. Yeah.
Twitter is not a safe space right now. Stand up, be heard, educate, not staying silent, role modeling behavior, hiring IENs in terms of impacts of ability of workplace. I think that you might be onto something.
I saw someone that wrote have difficult Thanksgiving conversations. So, have those conversations around the holidays with folks that you might not see very much in your family.
And I see that we've run out of time. This has been such an engaging conversation. So thank you for joining us on our Gritty Nurse podcast CNA conversation together. I'll just, again, so many great responses. We will aggregate them and send them. And I'll just pull up the last little bit of slides here, toggling back. Thank you. I see all the hearts. You guys are so awesome. Thank you for being a part of this conversation. And we didn't get to this, but we know that the CNA has been doing some great work. Again, we are authors. Get your book of the wisdom.
We're just putting a plug out there.
A little plug, but thank you so much. Please reach out to us. We're always willing to have the conversation. And thank you, CNA, for having us to talk about performative benevolence and racism.
Thank you so much.
Wow. Thank you, Sara Fung and Amie Archibald-Varley, for that reflective, engaging, inspiring discussion on performative benevolence as it relates to racism, and just that challenge around allyship just before we ended the session. Just so moved by your podcast.